This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie and from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenawalt, Senior Fellow with the Susquehanna Valley Center for Public Policy, and I'm joined on the show, as usual, by my co-host, Maura Donley. Now, again, because of the nature of the virus scare that is found around the state, around the country, and around the world, we're broadcasting a bit differently today. And Maura, you are broadcasting from your home studio, I believe.
Yes, my home studio, Charlie. It's very nice to see you.
Nice to see you too. Well, today we're fortunate enough to focus on this scare that we are dealing with, the COVID-19 virus scare. And the other week we were fortunate enough to have Andy Carter with us, the leader of the Hospital and Healthsystem Association of Pennsylvania. Today, we're fortunate enough to have with us Jennifer Jordan. Jennifer is the Vice President of Regulatory Advocacy for the Hospital and Healthsystem Association of Pennsylvania. Jennifer, welcome to the show. We're very happy to meet you and to gather together in this unique setting.
Thanks for having me.
You're quite welcome. Well, the news is all about COVID-19 all the time these days, and Pennsylvania's hospitals are at the forefront of this crisis. Can you give us an update? Where do things stand, Jennifer?
Sure. The Pennsylvania hospital community is proud of the collaborative work that we've been doing to help the state confront the COVID public health emergency. We're working very closely with the Department of Health and PEMA here in Pennsylvania to help hospitals both plan for the crisis and then manage the patient load. HAP, our emergency and management team, has been working with hospitals and other healthcare providers across the state. They were established as a contractee for the Department of Health in 2012. And so they've been working with the healthcare community to respond to various sort of local public health emergencies and local emergencies, be it tornadoes and floods and the papal visit. This is the first time we've confronted a statewide crisis and have done so collaboratively and really help support the community and fill the gaps and meet our healthcare needs here across the state. I'd say that it's a very dynamic health emergency, with some communities experiencing it very acutely, particularly in the southeast and the southwest and the northeast, and other communities having very kind of low and disparate outbreaks. But across the state, I think that the health community has really pulled together to face this as a collaborative front.
Well, Dr. Levine, our current Secretary of Health, has been saying that we have done a great job at flattening the curve, which is good because the whole idea was to not strain the resources of our hospitals. And it's so nice to hear that we didn't actually do that. We behaved ourselves and we stayed home. We did what we were supposed to. So right now, though, as regulations start to ease a little bit, we're seeing that people can return to the hospital and have some elective surgeries, which I think everybody's been really nervous about being in the hospital and going to the hospital for any reason. Can you tell us a little bit about this sort of easing of elective surgeries or other kinds of surgeries that hospitals will now begin to perform again?
Sure. Well, last Monday, I guess it was the 27th, Dr. Levine posted guidance to help healthcare providers start to think about rescheduling and restarting those necessary services. It's the reality that healthcare doesn't stop when there's a pandemic. We've been putting off necessary medical care, just trying to make sure that we didn't overwhelm the healthcare system. And the reality is that patients in our communities actually need the services that they've been putting on hold during the pandemic. This restart is going to be gradual across the state, with every hospital and every community assessing their situation and making sure that their pathway forward is safe for both patients and staff. But we'd ask that patients no longer put off these surgeries. If you actually need necessary care, you should begin to think about how to pursue it. Contact your provider and plan a pathway that's safe. And our hospitals are prioritizing patient and staff safety.
And patients can be assured that the hospitals are going to take every step necessary to keep them safe while they're doing these surgeries.
Absolutely.
Great. That's really good news.
Well, Jennifer, telemedicine has played a major role in healthcare lately. How will telemedicine fit into what we call or refer to as the, quote, new normal, unquote?
Right. I'd say that that was one of the biggest opportunities in this crisis, is to really flex and see the ways that new technologies can help fill the gaps when care can't be delivered the way that we are accustomed to. And we've done that very much so on the telemedicine front, both in primary care visits, routine services that you would have gone to the provider's office for, behavioral health care, substance use disorder. We've even seen some expansion of the use of telemedicine in that area as well. We've been meeting needs, particularly in rural communities, that always exist. Access is always hard in some of our communities, and telemedicine is a potential pathway to fill those gaps. So there have been a lot of waivers and reimbursement sort of rearrangements because of the COVID crisis that we hope stay in place as we move forward. I think the cat's out of the bag on this one. Patients know what it's like to receive a medical service in their own homes. And I'm hoping that our pathway forward includes both some of the flexibility and the capacities that we've developed during the COVID crisis to help provide efficient care going forward.
So what other kind of changes have we seen because of COVID-19?
We've seen a lot. Particularly, I'm one of the nerdy people who think about the regulatory front. This world where it's not just care delivery and reimbursement, but another set of rules that sort of define the healthcare delivery system. A lot of those rules predating COVID were from the 80s and the 90s, in a completely different healthcare delivery system, completely different technology, completely different medical practice. And we saw a lot of those rules be waived to help providers efficiently meet the COVID needs. We saw waivers at the federal level, at the state level, some reimbursement changes at the federal and state level that really sort of streamline processes, cut back some of the bureaucratic and administrative burdens that sort of are inefficient in the healthcare system, and really help providers actually just meet patient needs. We're hoping that the pathway forward continues to be streamlined and flexible, particularly as hospitals in a lot of communities will both have to manage COVID needs continually and other patient needs at the same time. So we're advocating strongly to maintain a regulatory climate that provides that sort of efficiency and flexibility.
Well, I know our hospitals in Pennsylvania have really been stretched in terms of resources, and because they have not been allowed to have a lot of these surgeries that would typically make them a little bit of money. The governor's very aware of this. They're working on it really hard. Overall, how do you think our hospitals are doing in Pennsylvania? How are they going to be going forward?
Right. Well, we have a lot of advocacy going on at HAP around the financial position of the hospitals. A lot of our hospitals going into the COVID crisis, we're in pretty precarious financial states, and the reality of just resuming services doesn't mean that that volume comes back and everything is back business as usual. They're going to have to maintain both the ability to rebound and flex for the potential new COVID surge and do the work that they're doing. So it is a very tenuous financial situation going forward.
That's very interesting, Jennifer and Maura, that you would touch on that point. Recently, just last week, I had to go to one of the major hospitals, and I won't identify the hospital, I'll just say it was in the center, south central, southeastern part of the state. And here on a Friday afternoon, where every parking space is normally taken and there are people everywhere, it looked like it was very, only about an eighth of the parking lot was full, and it was very sparsely populated inside. And the staff explained it to me that they were ready and willing and able to take in a huge influx of COVID-19 patients but that never happened. And that's a good thing for that patient in that area. But I think they were saying they had something on the order of 20 COVID patients there at any one time, and that was it. And the rest of the hospital was pretty much closed off. I don't know, how do we deal? This is all new territory, Jennifer. How do we deal with this new situation?
It is all new territory. I don't think that we've developed any best practices, but I think that it's going to take a very slow and deliberate process that prioritizes safety and still mitigates the spread of COVID. It's not gone from our communities. It's still there in our communities. And I think the pathway forward is very, it's very precise. It's very data driven. It still prioritizes infection control, but also meets the needs of those who need healthcare services.
Well, I think the Commonwealth of Pennsylvania and Susquehanna Valley Center and certainly Maura and myself want to thank you and want to thank HAP for all the good work that you do. And this crisis would be far worse if it wasn't for your association and all the good work that all of you do. Thank you. We look forward to having you back.
Good stuff. Take care. Thank you.
You're welcome. We'll be back with a second segment right after this.
Behind the Headlines is brought to you as a public service by the Pennsylvania State Association of Township Supervisors, the largest, most influential municipal association in the Commonwealth. Since 1921, PSATS has been preserving and strengthening township government and securing greater visibility and involvement for townships in the state and federal political arenas. Covering 95% of Pennsylvania's land mass, townships represent 5.5 million residents, more than any other type of political subdivision in Pennsylvania. Behind the Headlines is also brought to you by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry. The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Welcome back to the second segment of Behind the Headlines. On this segment of Behind the Headlines, Maura and I are joined by the Majority Leader of the Pennsylvania State House of Representatives, Bryan Cutler, from the 100th Legislative District in Lancaster County. Why, welcome so much, Representative. It's very kind of you to take time out of your schedule right now during the middle of this almost unprecedented medical scare to join us. We have any number of things that we'd like to talk to you about, and why don't we start out with Maura? You want to start off?
Thanks, Charlie. Thanks so much for being here, Representative Cutler. We are, as Charlie indicated, in some unprecedented times, and I know you've been particularly interested in telemedicine. We just spoke with some people from the Hospital Association, and more telemedicine has sprung up out of necessity for what's going on right now. I know you've had a piece of legislation, so do you want to tell us a little bit about it, what its purpose was, and you can tell us what happened to it.
Sure. The purpose was actually very easy. We wanted to both increase the availability of telemedicine for us as patients and also ensure that those providers that engage in that activity would be paid. And we did pass a bill. We included FDA regs, which unfortunately became kind of the centerpiece of the opposition. And it unfortunately became I think a misguided argument about it being an abortion bill or not in terms of access to abortions. When you look at the FDA regs that were included, of the 50 plus drugs that were on that list and require in-person delivery, one was an abortion drug. And unfortunately, the governor decided to veto it based on that, when in reality, it didn't matter if the bill was signed into law or it was vetoed. It would not have impacted the use of that drug because current federal regulations already require it to be delivered in person. So I think it was an unfortunate casualty in terms of that bill. I think it's a bill that we needed. And while the governor did, through executive order, increased access to telemedicine services after vetoing the bill, what he did not actually address is the payment. And I certainly don't want patients to get a surprise balance bill on the other side of this just because that bill was vetoed. So it's an issue that we're going to have to keep working on. But I also think it's one that we have to work on while being consistent with existing federal law.
Did you and other leaders have a chance to talk with the governor or meet with the governor to sort of enlighten him to all these background facts? Does he know what he did? Does he realize what the truth of the matter is now, Representative?
Yeah, we discussed that bill in length privately, and I made a very similar plea to him that it's an existing list of drugs. Federal law already requires it be delivered in person. It factually doesn't impact the delivery of abortions in the Commonwealth, and nonetheless, he said it was an issue that he felt very strongly about and chose to veto the bill. I certainly understand and respect his position, but I do think it is one that was wrong.
So what does your legislation do that is different than what is happening naturally right now, the need for telemedicine?
Well, a lot of what we're seeing happening now in telemedicine is being driven, as you point out, Maura, by necessity. The social distancing and, quite frankly, individuals who can be more easily managed with a distant visit through technology, whether it be through their phone, their computer, or whatever. So that has kind of grown up organically, which I always think is a great approach. Unfortunately, the piece that's left out is the billing component. And while we left a lot of flexibility in that for the providers and the insurance companies to negotiate those rates, we did provide the rough framework for them to do that. The current environment does not necessarily guarantee that, and my biggest fear is that our listeners may end up getting a balanced bill at the end because it's a coverage that's not provided, and therefore they end up paying for it out of pocket. That, I think, was completely avoidable, and I wish the bill had been signed into law.
So you mentioned that you're going to continue to work on this. Are you going to bring the bill back up for consideration, make any changes? What's the plan?
Well, at this point, we need to talk to the stakeholders again. I think when you talk to the folks at the Hospital Association, the different providers, I think we were all pretty much on the same page in terms of our understanding of the federal regs and how it would play out clinically. So at this point, we'll circle back with them and find out how we balance the requirements that are contained in the federal law as well as all our state laws and regulations at this time.
Well, when we watch news reports, Representative, from around the world and from around the nation, and we look at those areas that seem to be handling this virus the best, seem to emphasize extensive testing. And you and the House have recently addressed the issue of testing as well through House Bill 2455. I was wondering if you could tell our audience what the legislative vehicle was that you've been working on, and where are we going? Where would your caucus like us to go in regard to testing?
Well, I think there's a couple different components on testing, and this bill addressed both of them. The first piece was Chester County has a Department of Health, and their county commissioners had purchased some FDA compliant but not FDA approved tests. And our state Department of Health was blocking them using those tests. So Representative John Lawrence, who was the legislator from Chester County, introduced a bill that would have said, as long as the county health department and the county commissioners are paying for it and they're being FDA compliant, then they may proceed with that as they go forward. That bill moved. I unfortunately missed the deadline because we have a rule where you have to file the amendments a day in advance. And then we came in the next morning when we were going to be considering that amendment, and there was a quote regarding testing and a plan, and the fact that the administration did not yet have a benchmark for testing. And I found that to be very concerning, so I drafted an amendment, and that simply said that the State Department of Health must one, develop a plan, two, submit it to us, so that three, we could fund it. It was literally a page and a half long amendment. It was not long at all. So we were going to address it both from the county level as well as the state level, and then move that forward. Because it was late filed, we needed a rule suspension, which requires a 2/3 vote. And despite having, that debate, the House Democrats did not support it at that time. They voted against it, and we could not immediately consider it, but it would be in order for the next legislative day, which is ultimately how it ended up playing out. So everybody voted for that on the floor. 23 Democrats joined us in voting for it, because I think that there's overwhelming agreement that testing makes sense and that it's a necessary component. More importantly, it's a requirement under the federal plan to get some of the federal money. That is due by the end of this month. I believe it's the 3rd or 4th week in May. We have to have our test plan submitted to the federal government. So we discussed with the House Democrats what their concerns were, and we further amended that bill in appropriations so that we could get some retrospective reports, and then ultimately that bill passed unanimously on Monday of this week. So I think that shows that, one, we can work together. Two, I wish it had been a day sooner, because I think that we ultimately could have ended up in the same place but been a day quicker. But at the end of the day, we were able to come together and find complete agreement on that. That bill is currently in the Senate. I think testing will be an important component of any plan as we go forward. And I think it's going to be important because I think the data clearly shows that there are several high-risk populations that we need to address. Most of the deaths, when you look at it, are individuals who come from long-term care facilities or nursing homes. I know in Lancaster County, it's more than 77% of our deaths are related to individuals coming from those kinds of facilities. Prisons is another area where there's the potential for increased disease exposure. And in both cases, it's the dense population that seems to be driving it more so than a lot of other factors that may be considered in terms of the disease spread. The reason I think that's important is, and recently there was an op-ed in the New York Times, that they believe that population density is actually one of the main determining factors in how and where the disease spreads through the repetitious nature of the exposure in more densely populated areas. I think it was a very well thought out, well written proposal, and it's one that I think we have to take into consideration as we move forward. Testing will obviously be an important component of that, because the one advantage of both the prison populations and the nursing home and long-term care facility populations is they are easily sequestered, and in many cases already have heightened protocols in place for the residents' protections, and perhaps that includes limiting visitors or increased testing specific to those areas. So I think that data needs to be separated from the other county data so that we can have a good plan moving forward, one that protects the most vulnerable and those that are high at risk, while at the same time allowing the majority of the population to return to a more normal life.
Well,
So
go ahead.
Well, I know that this probably wasn't part of your plan, Representative, but we're getting a lot of attention in Pennsylvania because we are not testing a lot of people, and we're way behind what a lot of other states are doing. And I've been reading that a lot of our health systems have the tests, but they're not at capacity in terms of testing, because they're only testing people who are symptomatic, and they're not testing anybody who is asymptomatic. Is there any way to, between now and when we have a plan in place, to increase the testing that is currently happening so that we're at least utilizing the tests we have?
No, I think that's a great question, Maura, and it's one that we raised during the floor debate. The original bill, as proposed for Chester County, they wanted to test all of their frontline workers, their EMS providers, their fire, and their police. And then from those tests, they were the rapid tests, they would then identify people who may need a swab test, which is the more invasive test, and then they would do contact tracing around them. For example, if an ambulance person was positive, which patients did they transport, and then run down each one of those leads. That was really the goal. And to your point, there is additional capacity in the system, yet the focus continues to only be on those individuals exhibiting symptoms. We're starting to move beyond that. I know Montgomery County, for example, tested the prison population, and now they're moving into the nursing home world as well. I think you're going to see more and more of that. That's why I think it was important in this bill. If the state is unable or not in a position to oversee that level of testing, I think we need to incentivize it at the local level, whether it be with the county departments of health or the local healthcare systems that ultimately will be responsible for the patients. Early on, there was a limit on some of the reagents, some of the swabs, some of the raw supplies that you needed in order to run the test. So while the capacity of the test machines was very high, they may not have had enough to actually get it in place. But now we have federal money that's available that we must, by requirement of federal law, spend on COVID response. I think testing is the perfect place for it, which is why we passed the bill. And also, I think it's why, quite frankly, that they require the submission of the test so that we can get wider scale adoption of the testing. I think it's time that we see a more robust plan from the administration. We've been encouraging them both publicly and privately to do that. We'll continue to work with them to do that because we do think it's an integral part as we roll forward with the reopening. We have seen some counties come out of the current orders. I wish it were more, and I wish it was a little quicker while still focusing on those high-risk populations and protecting them. I think that we can balance and do both.
Well, Representative, in the last minute, your House Bill 2455 would be of very great interest to the public, and particularly to those who are interested in good practices in government. In there, you require the governor to provide regular reports on testing, and those reports have to contain information on the number of tests that are needed, the costs, the testing resources that are available. Where did that idea come from? It seems that that's something that would make the whole system more accountable and make everything work better. But
well, that's a great question, Charlie. We actually drafted that here in my office based off of the quote that there was not a benchmark by the governor or necessarily a plan. And we tried to give plenty of flexibility to that because we're not saying you have to buy a certain kind of test, or we're not saying that you have to do so many tests per day. We're saying just give us your plan so that we can appropriate the money that's required to execute it. And we would approve the plan simply by that appropriation. I think it's the way government's supposed to work, collaboratively and equally between co-equal branches of government. And we also require some retrospective reporting related to the data and what those results are so that we can continue to make better decisions.
Unfortunately, we're out of time, Representative, but we want to thank you very much for joining us today. And we ask the public to take a look at the Majority Caucus in the House, because you've had over 24 proposals about COVID just since this outbreak. So congratulations on a job well done.
Well, thank you, Charlie.
You're welcome. And tune in again next week. We'll see you then.